Hi, everyone. Good afternoon and welcome. We're so glad you're able to join us today to talk about a really important topic that affects families everywhere, and that's insurance coverage for mental health and substance use disorder treatment, and specifically what to do if your health plan denies coverage. I'm Lindsey Vuolo, and I lead the policy team here at Partnership to End Addiction. Our organization supports families impacted by substance use and addiction, and one of our priorities is improving access to high-quality, affordable addiction treatment. My work focuses on how to use the Parity law and other insurance coverage requirements so that people in need of addiction treatment are able to more easily obtain affordable life-saving care. The Parity Act is a federal law that prohibits health plans from discriminating against individuals seeking mental health and substance use disorder treatment. It requires plans that offer those benefits to cover them without barriers and roadblocks to access that do not apply to medical and surgical benefits. This means that a plan can impose more restrictive visit limits, impose higher cost sharing, or apply more onerous prior authorization requirements to mental health and substance use disorder benefits as compared to similar medical or surgical benefits. Insurance is really complicated, but parity is actually quite simple. Parity means health plans must treat addiction like any other disease. And yet we know that despite these protections, individuals and families continue to face denials for mental health and substance use disorder treatment all the time. Families who call our helpline and participate in our parent coaching program have shared stories about emptying retirement and college savings accounts to pay for the cost of treatment, despite having insurance. We hear from families who, after working so hard to get their loved one into treatment, find that their relief is short-lived when they learn that the health plan has denied coverage after just a few days or even hours of care. Often, individuals and families are forced to forego life-saving care because they can't afford to pay for the cost without insurance coverage. These devastating outcomes are not inevitable. Today, we'll share with you information and resources that are available to help individuals and families who are facing insurance denials for mental health and substance use disorder care. I'm so grateful to have two very important people with me today for this discussion. Maureen O'Reilly has a very personal connection to this issue, and today she will graciously share her story with us of what happened when her insurance company denied her son life-saving addiction care. Maureen is a licensed attorney in New Jersey and graduated from law school in 1981. Initially, she was employed by Chubb Insurance as an insurance defense attorney and then stayed home for several years with her young children. She returned to work as a public defender when her oldest child, Ed, was going off to college, and worked as a public defender for 15 years before retiring in 2021. She had many clients over the years who suffered from addiction and found the courts had little understanding of this illness. It was always treated as a criminal issue and a choice rather than a medical issue. She believes the courts have gotten somewhat better in the last few years, and the judges and prosecutors have become more educated about addiction. One example is drug court is now called recovery court. Although she was a public defender working with those suffering from a drug addiction, she'd never heard of fentanyl as of 2016, which is what killed her son in Florida that year. We're also joined by Andres Mendez, a senior benefit advisor at the Employee Benefits Security Administration, which is part of the U.S. Department of Labor. As a benefits advisor, Andres assists workers and their families, plan sponsors, and third-party administrators with complex employee benefit inquiries. He leads the agency's Underserved Communities Outreach Task Force and has worked to form relationships with government agencies and nonprofit organizations to educate the public on mental health parity, among other laws. He holds a Master's of Science in Business Analytics and a Bachelor's of Arts in International Relations. Thank you both so much for joining us today for this discussion. Maureen, I'd like to start with your story, and I'd love for you to share about your son, Ed. Could you tell us about him?
Ed was 28 years old when he died, and he was a chemistry major in college. He was very, very smart, and in fact, when he took the SAT as a senior in high school, he got a perfect score of 800 in the math section. And I think he had about a 760 in the verbal. So he was very, very smart. So he went off to college. He went to college in Washington, D.C. He had a very witty, quirky sense of humor. He was also a very sensitive person. And I think struggled somewhat because of how sensitive he was. But as I said, he was very smart and did major in chemistry in college. I think he started, he was exposed to heroin maybe at the end of his sophomore year. And that caused him to really struggle at that point through college. However, he persevered, and he went to college for about 5.5 years before he graduated with a chemistry degree. But as far as his personality goes, he was very appreciative of anything you would ever do for him. He would always say my cooking was so fabulous, whereas my other children would complain about it. Anything that you gave him, he said, was so delicious. He just had a very funny sense of humor. I just read a Facebook conversation or a text that he had with a young woman that he met right before he died. And I don't know if you find the humor in this, but her name was Olga. So when he first started talking to her, he called her Helga as a joke. Then she said, "Oh, do you want to see my son or my child?" And he was a little surprised. He said, "Sure." And then she posts a picture of her cat. So she seemed to have a personality or a sense of humor that matched his. And it was kind of sad to read at the end that he finally, met someone when he was in Florida recovering that, seemed to be a good companion for him. But anyway, that was his personality. He was the oldest of my 6 children. That's why I was home for about 15 years before I went back to work. My children, the younger ones, all were crazy about him. So it's been so devastating for them to lose him. He was such a presence. My youngest son is about 12 years younger than Ed. And he said to me the other day, I said, "Do you think about Ed a lot? And do you still feel sad?" And he said, "It's a very empty feeling, very empty, even though he still has the other 4 siblings. Of course, he misses his oldest brother. And they had a very good connection with each other. One was the oldest, one was the youngest. So I guess I don't know how else to describe it. It's hard to describe someone, fully.
Of course.
But that's what I have to say about Ed.
Thank you for sharing those stories about him with us. You mentioned that he struggled with heroin. Know that at one point you tried to help him get treatment for his substance use disorder. Can you tell us what happened when you tried to get treatment for him?
Yes. So he did. He was living in an apartment in New York, but he had to come home because the addiction got so severe. He had lost his job. He worked in a laboratory. And then his romantic relationship broke up, all at the same time, within the same week, really. So he came home to us in New Jersey, and I could see he was in very, very bad shape. He was thin. He was apparently injecting heroin every day and also using cocaine at the same time. So finally, he was here for about 2 months, and we confronted him, my husband, myself, and my next oldest son, who's just about 2 years younger than Ed, and said, "You have to get in for treatment. This can't go on." So he agreed to go for treatment. The minute he said he would go, I put him in the car. It was the middle of the night. It was a Saturday night going into Sunday morning. So it was 2 a.m, 1 a.m, 2 a.m. Drove him to the closest detox, which is in the next town. Got him in there. The nurse said, "Don't worry, we'll take great care of him." It was now going into Sunday morning at that point. He was there on Sunday, there on Monday. By Tuesday morning, Horizon, a very expensive private insurance plan, Horizon Blue Cross Blue Shield of New Jersey, was calling me up, telling me that he could not stay. He had to leave. They felt that he could just recover at home. Now, he wasn't in for regular rehab. He was in for detox at that point. How they thought he could detox at home was unbelievable. They said, "Well, he has sober parents. He can just rehab or detox at home." They didn't even know us. They didn't know whether we were sober or we weren't sober. We could have been anything. So he had to leave the detox, and I immediately got him into another rehab. This was not a detox. It was a regular rehab. They took him in. They also realized he needed a high level of care, a detox level of care, even though insurance said he did not. They put him in the detox section, even though insurance was only paying for regular standard level of care. they put him in their detox to finish off his detox, which took another 4 or 5 days. After that, they wanted to keep him for another 30 days. However, again, we were notified by Horizon that again, he had to leave, that he should recover at home, again, with his sober parents. He had no need for detox or a regular rehab. So instead of being able to concentrate on his recovery, he was told he had to leave. And the rehab, it was called Sunrise in New Jersey, would appeal. They would get another 24 hours. They would appeal again. They would get another 24 hours. They did a third appeal. They got another 24 hours. He was being told every day, your insurance wants you to leave. Your insurance wants you to leave. So he couldn't concentrate on his recovery at all. He was too distraught. Finally, after the third appeal, the recovery center threw up its hands and said he has to leave. Insurance is not covering it. I didn't know what to do at that point. I went and got him. At this point, he had only been in the rehab for about, close to 2 weeks, but the last 3-4 days were so haphazard with him being told he had to leave. Got him, and then we immediately the next day put him on a plane down to Florida, because there are so many rehabs down there that will indicate that they'll take your person addicted to drugs, and accept whatever insurance will pay. I had no idea of the chaotic situation which was going on down in Florida. I thought Florida was like any other state, and didn't realize it was such a den of drug use and fraudulent, I guess, recovery centers. So I did send him down to Florida on a plane. He was very hesitant about going. I think back about that now, and I'm so sorry that we insisted that he go. We had no idea that we were sending him into like a lamb being slaughtered, being sent to slaughter, being sent down to Florida. So the rehab down in Florida, they have some sort of a technique where they test you for drugs every day and then charge the insurance company thousands of dollars. And the insurance company pays for that. And I guess that's how they make their money. They'll pay for this testing of your urine or blood, but they won't pay for actual treatment. But I guess that's how the rehabs make some of their money, by this constant testing. After the stint in that recovery center for 30 days, and we had no idea what was going on down there, they sent him off to a sober house, which was basically more or less a flop house. It wasn't a legitimate sober house like you would find maybe in New York or New Jersey. There are so many, scam artists down there operating these. It seems like anyone can open up a recovery house. You could just buy some kind of a shack down in Florida and call it a recovery house. Anyway, that's where he was sent, to a place like that. After a while, he did relapse, and they did take him back in for 2 weeks. Got out again, relapsed again. He was back in again for a short period of time. And that's when they sent him out to some third sober house that was eventually shut down by the Florida authorities after my son died there. My son went into a bathroom, relapsed with the use of, I think he was asking for cocaine, but apparently got cocaine laced with fentanyl. And that's how he died, alone in a bathroom. The door was locked. No one noticed for, 8-10 hours that he was locked in there. And finally someone broke the door down. But by that time, he had been dead for several hours. The owners of the sober house were eventually arrested. It was a husband and wife team. I'm sorry, I think I'm going on too long. I don't know if you have new questions for me.
No, Maureen, I'm so sorry for your loss, and thank you for sharing all this with us. And can you just remind us what year did this happen?
So this was back in 2016. And as you said, I was a public defender, but I had never heard of fentanyl. And I'm not sure that it was really that prevalent up here in New Jersey or New York. I have a feeling that it was more prevalent at that time down in Florida. So I kind of feel that I sent him to a place where it was really beginning to come in through the border or whatever way it gets in here. Of course, it's all over the place now. But back in 2016, I had never heard of it, and I never knew anyone that had ever died from fentanyl or overdosed from it.
Sure. And when you sent him to Florida, because why did you end up pursuing treatment in Florida? Was that because you weren't
Because Horizon would not pay for any treatment in New Jersey. I feel that the places in New Jersey are more legitimate. They're more, I don't know if they're more supervised by the authorities, but they seem to have more legitimate, organized programs. The places in Florida, I guess what they do is they accept whatever insurance will throw at them and figure out a way to make the money in other ways, either by testing the urine every day or patient brokering is very prevalent down there. I'm not sure, what different ways they have, but they do advertise on the internet that they will take your loved one and give them treatment and try to work with the insurance company. So that's how that situation came about.
found them when you were facing all these denials for care closer to home?
Right.
What did you, when you were denied treatment, what did you do? Did you reach out to you mentioned that the treatment facility was appealing denials and with the insurance company, but did you also reach out to the insurance company?
Yes. So I wrote a very lengthy letter to the insurance company. And I also called up. I made many calls. I finally got through to the secretary of the CEO of Horizon Blue Cross Blue Shield. And I told her the situation and everything that Ed was using. And she said, in kind of laughing manner, she said, "Oh, God bless him," kind of laughing about the whole situation. And I knew then that it was just a wasted effort to try to deal with her or get through to her. I was, pleading with her for him to get the proper treatment. Eventually, all of my appeals and letters caused them to do different peer reviews, and an independent entity actually eventually reviewed the case and decided that, yes, he was improperly denied detox treatment and rehab treatment. But I was never notified of that result. By this time, he's already down in Florida. If I had gotten notification of that result, I would have brought him back and put him into a legitimate facility up here in New Jersey, but I never got notification. I only saw that information after I brought a lawsuit against Horizon. And I found an attorney who brought the lawsuit on my behalf. And together we got all of the records, all of the peer review records, all of the reviews that were done by an independent entity. I forget the name of it right now. And I was just shocked to see, these records indicating that, the result was that, yes, he was improperly denied. Initially, the denials were done by physicians. A physician, a doctor would actually sign the letter denying him treatment. And I would look up these doctors, and they were located in Philadelphia or Pennsylvania. One was located in California. Another was located, I don't know, maybe in Vermont. And I would look up these doctors, and their specialty was, they were, a regular family doctor or an internist. It wasn't somebody who was some type of an addiction specialist. So I guess these doctors are just on the payroll to add their name to a letter denying you treatment, so that somehow looks legitimate. So it was, 4 or 5 different doctors who would sign these letters denying treatment. So that's the setup that they have. I assume they still have that today. The insurance that I had for Ed, it was just for Ed himself. The other members of my family were still covered by my insurance through the state of New Jersey, working as a public defender. But once he turned 27, that ended. So I continued his insurance through, I guess it's a Cobra, and just paid for him alone $750 a month, which at that time was a lot. I'm sure it'd be a lot more now today. So he was supposed to have the full insurance that he had prior to turning 27. The policy, I read it, it says that it does fully cover fully cover addiction and mental health treatment. But in fact, it obviously does not. And of course, then I learned about the parity laws at that point, but it seems like the parity laws are not enforced. So I know that since this happened, I learned that there are actually attorneys that specialize in helping you when your insurance company is denying treatment. I wasn't aware of that at that time. I would have, been able to contact such an attorney at the time to help me with the process. But I didn't become aware of that till later. Even though I'm an attorney myself, I just wasn't aware of that specialty.
Sure.
So.
And when did you end up bringing the lawsuit against?
So for the first 9.5 months, I could not even hardly get out of bed. I had to take a leave of absence from my job for 9.5 months. They held the job for me. I finally went back to work. And by that time it was June of 2017. So I started to be able to function a little bit better. And at that point I started looking for an attorney that would bring a lawsuit on our behalf. It took me over a year to find somebody. All the attorneys I contacted said no, they would be too difficult of a case. It would be too impossible. There was about actually a month left before the statute of limitations would run. And so it would be the very end of the 2-year period. I finally found an attorney that agreed to handle the case. And he's actually an employment attorney. That's his specialty, employment and, harassment attorney. But he took on the case. That would be his very first case of that type. He took on the case, and we did get a settlement from the company. And also the company that they used to help them deny claims. They had another company that would also help them with the process of denying treatment.
And when did you settle that lawsuit?
So that lawsuit was settled, I'm trying to think, I would say back in 2020, I would say 2020.
That's when you learned about that the denial had been, one of the denials for treatment in New Jersey had been reversed on peer review.
As we were going through the discovery process and got all the discovery that was in the paperwork. I actually got all that discovery on my own before I even found an attorney. So I actually got all that paperwork, which was helpful because then I was able to show that to the attorney. And that was, I'm sure, a factor in him taking the case.
Sure. So yeah, you were able to sort of bring a lot of your attorney knowledge.
Right.
To this situation. And, having been through this experience, and particularly as a parent, what advice would you offer to other parents who might be going through a similar experience?
So I would say the number one thing is, and this doesn't even deal with or have to do with insurance, the number one thing would be to treat this as you would any serious medical condition. So in other words, if your son was diagnosed with brain cancer or blood cancer or stomach cancer or whatever, you would immediately drop everything. You might even take a leave of absence from your job or quit your job and stay at home and figure out everything you could possibly do to help your child. And that would be my number one advice. You treat this as life and death because that's what it is. Instead of doing that, I went off to work every day, not treating it as I would if I had been told he had brain cancer or anything else. I went off to work every day, left him home alone. He was very, very depressed. He didn't want to be addicted. He wanted to be free from his addiction. So that would be my number one advice. Drop everything. And I know people have to work. There are single parents. In my case, I could have stopped working and I could have still lived comfortably. So that's my regret. Other people cannot do that so easily. So I realize that advice can't really apply to everybody. So aside from that, though, getting back to the insurance aspect, I would say there are insurance attorneys out there that, I'm not sure how you find them, but who deal with insurance issues when you're having trouble with your insurance company. They would immediately write a letter on your behalf. Your insurance company would see that this is someone who has the expertise and knows how to deal with the insurance companies. Also, again, I did not know about that peer review or independent review that reversed their ridiculous decisions to deny treatment. I'm not sure how you would get that information right away. They don't freely give out that information. I only got it, by asking for it repeatedly.
Mm-hmm.
I would say yes, appeal. In my case, the appeals did not work. As I said, they would only give another 24 hours each time, and the recovery center gave up eventually. I would say call them up, but again, that didn't work for me either when I called them up. I'm sorry now that I didn't deplete my retirement funds. I do have retirement funds, and I'm sorry I didn't deplete them and do everything possible to get him better. Even if my funds were completely depleted and my son died anyway, at least I would have the benefit of knowing I did everything. And that would give me some solace. So I would say, yes, deplete your funds if you have to. You can fight with the insurance company later and try to get reimbursed later. Get an attorney later who will fight on your behalf to get that reimbursement. But I would say, yeah, if you have the retirement funds, use them. If you have any savings, use them. Spend every penny you have to get your person, your child better. And that's my biggest regret, that I didn't do that. Again, you don't think that the person's going to die. So for some reason, I guess I felt I had to hang on to my retirement funds because I would be retired at some point. That is really, when I think about the whole situation, that's my biggest regret. So as far as, getting back to insurance again, I'm not really sure what the answer is. It's great that I sued them. And I can tell you the amount that I got if that's of any interest. Certainly it was not an amount that replaces your child.
No.
And the reason I did it was to hopefully get the insurance company to change. However, one person bringing a lawsuit is a drop in the bucket. It would have to be thousands of people suing them after their child dies. It would have to be thousands and thousands. And then I think that would be one way to get the insurance companies to change. So obviously the money that I received, and the attorney, of course, received 40%. It was a difficult case. He took it on and it was 40%. So if the amount that you actually receive in the end is of no consequence anyway. And plus it's not a huge amount. But I was happy to at least get that chunk from the insurance company for what it's worth. Again, it's a drop in the bucket to them. They make such profit. I think they're one of the industries in the United States that make, the most profit out of all the different industries you can think of. So again, I wish it was hundreds and thousands of people that would bring the lawsuit like I did. But of course, most people, are not attorneys. It would be only maybe attorneys or very, very educated people that would even think to do this.
Sure.
Or who have the wherewithal to do it. So, that's all I can say. I'm sure my lawsuit had no effect on them whatsoever as far as what their procedures are.
No, but I think you're right. Symbolically holding them accountable for what happened. And you're right that no amount of money could ever compensate for your loss. And I am incredibly sorry for everything, for the loss of your son and for everything that you have gone through. And I really thank you so much for sharing your story with us, for speaking out. I think there's tremendous value in advocacy and parents sharing their stories. And it is these stories that will change hearts and minds, which change policies and practices. So I think this is tremendously important, and very grateful for you participating today and sharing your story.
Can I just say one more thing?
Sure.
Oh, sorry. I just wanted to add, when your child or loved one goes off to a rehab, I think it's beneficial if they're in a rehab center that's near your home that you can visit regularly and check out. I think that's very important. If you can visit them once a week, once every 2 weeks, whatever, you have to see what's going on there. Once they go to a sober home, you have to check that out as well. And make sure it's not just some flop house.
No, that is great advice. And we, as I mentioned at the beginning of the broadcast, we provide services to families impacted, who are impacted. And that is exactly the advice we give, to make sure that they stay connected. We have a number of resources which we can share that talk about what to look for as well, in treatment programs, and different red flags and questions to ask. Because I think there has been some work to improve some of the brokering and fraudulent treatment practices that you mentioned that were, quite pervasive a few years ago. But certainly there's still that needs to be done to make sure that there's good quality, people are receiving quality care. And I think that there's many different entities responsible for that, but certainly parents being involved and engaged, and having a loved one close to home, which I know would have been your preference had insurance, is also really, really important. So thank you, Maureen.
Thank you.
So Andres, I was wondering if you would share some information with us. First, if you could start out by just explaining what EBSA is and what you do.
Sure. So the Employee Benefit Security Administration, or EBSA, we're an agency within the U.S. Department of Labor, and essentially what we do is we oversee federal laws that pertain to health and retirement plans offered by private sector employers. The agency provides education to the public about their rights under these employee benefit plans, and also, if need be, we provide assistance to those participants when they experience an issue or if they have a particular question. So one of the laws that I'm here to talk about today, unfortunately, is Mental Health Parity and Addiction Equity Act, or MHPAEA, as we like to refer to it as. So MHPAEA, as you mentioned in the beginning of your presentation, you called it the parity law. It basically assures that mental health and substance use disorders are covered like medical or surgical benefits without special barriers or roadblocks. So basics about MHPAEA, right? So it applies to employer-based health plans and health insurance carriers. And it applies to private employer-sponsored plans with 51 or more workers. However, I will say that most small employer plans also comply with MHPAEA. It applies to health insurance coverage sold to individuals through the marketplace. So this would be healthcare.gov, which most people are familiar with. It applies to some Medicaid plans. So if someone has a state coverage option, that's also something that would apply. The Children's Health Insurance Program, which kind of goes hand in hand with Medicaid. It's important to know that some plans are not subject to MHPAEA, to mental health parity. This would include church plans, which could apply, to any given person, I guess, or also certain small employer plans that, like I said just a minute ago, most small employer plans, they have to comply with parity rules that apply to essential health benefits, right, laid out under the Affordable Care Act. So someone might ask themselves, what specifically does mental health parity MHPAEA protect? And so MHPAEA was actually passed in 2008, and it generally prohibits employee benefit plans and health insurers from putting limits on mental health or substance use disorder benefits that are more restrictive than some other kind of medical treatment. It protects coverage for mental health conditions, but also substance use disorders. And so some examples of what this is intended to protect. So in terms of substance use disorders, which obviously the most relevant category in this event, narcotic addiction. I know that the opioid addiction is something that gets a lot of media coverage now, particularly given what's been happening in the country during the last decade, or even longer for that matter. Alcohol addiction, basically addictions as a category in general. Mental health, anything like depression, bipolar disorders, anxiety disorders, suicidal ideations, et cetera, et cetera. And so examples of treatment could include general psychological or psychiatric care, as well as residential inpatient and outpatient care for substance use disorders. Another thing that could be useful for anyone watching or listening could be, what are some red flags, some indicators that an insurance plan may be in violation of this law, in violation of MHPAEA? and that it may warrant further review either on your part, or on our part, if you contact us, which I'll go into in a little bit. Um, so there are what are called quantitative treatment limitations. Basically, think numbers, right? Quantitative numbers. So what this means is that you could have a situation where your health insurance plan um, basically assigns a higher copay or co-insurance for medical surgical benefits than they do for substance use disorder benefits, right? So that is something that would definitely warrant at least someone taking a look at it, perhaps contacting us and walking through it with us, maybe sharing your documents with us. Um, Something else that could fall under this category is, for example, if your health plan has separate deductibles or out-of-pocket maximums for mental health benefits or substance use disorder benefits as opposed to medical and surgical benefits. This would probably be a fairly clear-cut violation, but regardless, it's good to talk through it with us, and we could definitely, attempt to take action on that, help you out there. Um, However, there is another category that's much less obvious, right? Because when you're dealing with numbers, if you see a discrepancy, well, that's very easy to identify. Most people could probably, uh, given the right information, figure out that something's wrong there. But in terms of non-quantitative treatment limitations, these are basically barriers that have been put up by health insurance carriers to people getting access to these benefits. And obviously they're less obvious, they're a little bit more difficult to identify. So what are these, right? Uh, One of them could be that maybe the plan's network of mental health treatment providers is much less complete than is list for general medical providers or other kinds of specialists, and so this makes it harder or impossible for you to find providers who will actually give you covered treatment at an in-network rate. So maybe someone tried calling all the mental health providers, or uh, a very high amount of mental health providers in their area that are supposedly in network, but maybe none are calling you back, none are accepting new patients, or these providers are located far away from you. You have to go out of your way to find them. These are all signs that there could be an issue with the plan itself, that it's a systematic problem. Um, Also, the health plan, if they require pre-authorization or concurrent review for all mental health benefits, whereas they're not really asking that of other benefits, that's also a pretty big red flag. So, for example, if a plan requires pre-authorization every 3 months for medications prescribed in connection with mental health benefits, uh, that could be an issue, probably an issue. If the plan refuses to cover mental health treatment because you failed to basically meet previous treatments, or seek previous treatments, or because there's no likelihood for improvement, well, unfortunately, we've heard things like that said, that's likely an issue. Also, if the plan will not cover, let's just say maybe perhaps going into wider um, mental health issues, like let's say maybe they say something like eating disorders we will not cover services for eating disorders, but for diabetes management they do cover certain services. That's probably a problem. You asked in terms of, what advice would you give to individuals who are being denied care, and maybe what are some examples of the ways in which our agency has helped people out who are experiencing these issues. So the first thing that people should know is that they have the right to appeal these decisions, and they have the right to see their health plan information. As Maureen was mentioning, she was able to get this information from her health plan. But then again, Maureen also has the advantage of being an attorney. So she's familiar with these concepts. Most people may not be. Or they might not know that they have the right to do this. They may not know how to go about it. And so this information is actually crucial to helping you understand what mental health benefits you or your loved ones are entitled to, basically whoever's on the plan is entitled to. And will also help them learn whether their plan is complying with mental health parity. So one thing that we would recommend that you do in any situation like this, if you don't already have it, is that you contact your plan to find out why the claims are denied, which this is something that you should be receiving anyways, as in documentation. But if not, then you could request that information, and you could also request a copy of the rules of the plan. So there are essentially two versions of that document, right? There's what is called a summary plan description, which is a huge document, hundreds of pages, goes into a great level of detail as to what is and is not covered, with procedures that the plan follows to make decisions, et cetera, et cetera. It will also contain your appeal rights and how you actually submit an appeal. It could be different according to each plan. Some plans you still have to do it the old-fashioned way with a written appeal. Some allow you to start appeals over the phone now. It really just depends, but the plan documents will speak to that. Um, Also on our webpage, which I've been told that this information will be put in the chat and or at least published. But our agency has a publications page, or this is it's titled publications, where we have a publication that is titled Filing a Claim for Your Health Benefits. We find this one to be particularly useful, and you could even download it, and it goes into what I find to be a fairly accessible explanation of how to appeal denied health claims. And in any case, you could always reach out to us at our phone number. I'll state it for the benefit of the viewers here. So it is 1-866-444-3272. And, we're available to answer questions or assist you if needed through this process. I think it is worth noting that there are some instances in which the plan may be correct to deny or is correct to deny certain claims, and that may not that may not violate parity law. So if the service is considered experimental or investigational, it's fairly common for those claims to be denied. Not saying that the denial is final. Maybe in an appeal, or with extra information, you might be able to get it approved, but that may be an indicator that something actually is being correctly denied. If the service is not uniformly covered under mental health and uh, medical surgical benefits, that's also probably something that would lead to a correct denial. If the service is not considered medically necessary, this one I would say, just to err on the side of caution, definitely contact us and we could walk through these situations. But that could be a reason to legitimately deny a claim. Also, if the service is no longer appropriate in a specific healthcare setting, that could also be a reason for them to correctly deny. But some examples of inquiries or types of inquiries that we get where we've helped people out in the past, right? People like to know, what can you actually do for us? Um, so some of the common ones that we get and that we help people out with. So let's say maybe a psychiatric hospital admission was being denied because it was out of network, right? There was no child psychiatric beds available in the area at the time that that the participant was living in a certain area, and so they're not able to access care. And in those instances, we as benefits advisors have been able to contact the plan and perhaps seek a single case agreement to cover something that was out of network at an in-network rate. Uh, that's something that we've seen success with. But again, these are case by case basis, so it's good to give us a call and we could always walk through it. We have plenty of inquiries where maybe certain claims are not being processed according to the plan documents. Just because you submitted a claim doesn't always mean that the plan rules are being followed. And so the benefits advisor can connect with the health insurance carrier or perhaps even the employer if the person provides permission to do so. We never contact employers without getting permission from the inquirer, but we can contact them and inquire as to how they're actually going about approving or denying these claims, and that may be helpful in terms of us getting a claim approved ultimately. Uh, and so we've also received inquiries where maybe um, claims have been denied because pre-authorization was not sought. And in some cases, the plan is correct, but in some cases, it's simply a standard that is not applied uniformly to other claims, to medical and surgical problem. And also, in some cases, it could be argued that seeking prior authorization in an emergency is probably not possible, and it's an incredibly high standard to hold someone to. That's it with regard to you know what a person should do if they have a claim denied, or and or what we can do to assist.
Great, thank you. And when someone calls the phone number or files a complaint on your website, what sort of process can they expect?
Sure. So I think here would be important to talk about who you'll be interacting with. There is a team, EBSA, the Employee Benefits Security Administration. We have a team of benefits advisors, me being one of them, in each of our 10 regional offices throughout the country that provide, who provide free assistance to the public and on a broad range of benefit topics. One of them being mental health parity. Uh, so benefits advisors specialize in informal dispute resolution, right? We're not really auditing a plan. We're simply approaching, like if we had to contact an employer, even in the case of insurance, we're simply attempting to help the participant seek information, or gather information. Uh, and perhaps if there is an issue, we could try to address it informally with the insurance carrier, approach them and say, hey, we believe that this is in violation. And if they fix the issue, then we kind of just, leave it at that. Um, Benefits advisors can assist participants. Also, this is important. We can assist participants in their native language or procure translation services. So if someone does not speak English or does not speak English with as high of a proficiency that's needed to understand some of these topics um, in detail, we can always find a way to assist them. That's something that what we're trying to push for. Members of the public can call our toll-free number, which again I mentioned previously was 1-866-444-3272 during business hours and reach a live benefits advisor. Business hours 8:30 a.m. to 5 p.m. But again, like I said, we have benefits advisors across the entire country, so that also will come into play. Uh, Generally, the benefits advisor will answer questions and assist with specific benefit issues. If the call is received after business hours, I know people sometimes have that question too. Uh, it will generally be returned by a benefits advisor within 2 business days, although I would say the agency in general is pretty good about returning it before that. Um, Members of the public can also contact us electronically if you prefer to do so. If it's more expedient, maybe to do it that way, you can send us a web inquiry at askepsa.dol.gov. So the website has a function to basically give us your name, your contact information, and some details about the issue that's ongoing. That way, we're prepared when we call you back or when we send you a response email. Um, Generally, a response will be obtained within 2 days again, but we usually try to respond as quickly as possible after receipt of that inquiry. And also, I guess it's important to know, as I've been mentioning, that benefits advisors can contact employers with your permission, and insurance carriers to help participants access mental health and substance use disorder benefits. But again, we will not do so without express permission from the participant. So that's kind of what people should expect when they call our agency.
I just have one question.
Yes.
Does the parity law also apply to benefits that are obtained through COBRA, where the person has turned 27 and now you have to continue the insurance through COBRA?
Yes. So when someone elects COBRA continuation coverage, as you mentioned, and I think that you did a really good job of it, actually, you probably explained it clearer than I would have. The basic rule is that COBRA coverage has to be identical to the coverage that you had immediately before your qualifying event, right? So either termination, which could be voluntary or involuntary, or reduction in hours, it has to be the same. So to answer your question, yes, MHPAEA does apply to participants who continue coverage under COBRA.
Mhm.
Hmm.
Okay.
Yeah.
And maybe if you could just, and you may have mentioned this, but just sort of reiterating, Department of Labor has authority. What type of health plans would your benefit advisors have authority over to investigate?
Yeah, sure. That's fine. So I always like to give a basic explanation by saying that this agency, the Employee Benefits Security Administration, we have jurisdiction over private employer-sponsored health and retirement plans. So I would say that the overwhelming majority um, of people in the country probably have an employer-sponsored, a private employer-sponsored health plan. So to go into more specifics, um, basically it applies to private employer plans with 51 or more workers. But again, I also added the caveat that most small plans also do comply with MHPAEA, with mental health parity. Um, Also, this applies to anyone who has uh, bought or I guess who is insured through a marketplace plan. So through healthcare.gov, this is an option that is available to people when they lose their job, but also, you'll see commercials or hear commercials on the radio or television, when we start getting around fall time. So maybe October, November, in the lead up to the new plan year, you'll hear that they have open enrollment for the marketplace. Those plans, that broad category of plans, also has to comply with MHPAEA. People who are covered themselves or have children covered under state programs like Medicaid or CHIP, Children's Health Insurance Plan, they MHPAEA also applies to those plans. And like I said, in which cases may it not apply? um, Church plans are exempt from MHPAEA. They're not subject to MHPAEA. And in case by case situations, maybe certain small employers, but if in doubt, I would say give us a call and we'll help you try to figure it out. And I will also say, though I cannot advise with regard to state law, because obviously I'm a federal employee, but we can always attempt to help people identify laws in each state that could help them out, right? Not that I could advise on them, but we could certainly help identify them.
That's really helpful. So,
Yeah.
first of all, individuals probably don't need to know whether they have a federal or a state regulated health plan.
Yeah.
But that's something that you could help someone figure out.
Oh yeah, for sure. We would say if in doubt, just you don't lose anything by calling us, right? So.
Can I just ask another question? When you say
Yeah.
private employers, you mean private companies, but if you have insurance through your job with the state, is that separate from private employers?
Yes, that would be. Yeah, so I guess it would be considered a public employer in that case, and what laws they're subject to would be something that we would have to sit down and look at in that case. But that's not to say that if someone has a public employer, which I would find myself in that situation just on the federal level instead of the state, we can always take a look to see what recourse you might have in those cases. Like I said, there may be, first of all, the plan may actually just follow MHPAEA. That's something that is done quite often. I guess I could bring other examples here. So there are some states that, for example, mirror federal law in most cases, right? So for example, let's just say I'm in Illinois. Illinois has its own laws to bolster existing federal law. So under, let's just say maybe you have 18 months of continuation coverage. Under Illinois, you have 12, or they have to offer 12 for those plans that go under that law. But there are some states that simply just defer to what federal law says. So again, we can analyze that, look at that, and then tell you how we think you should proceed. Okay.
Thank you.
Thank you.
Yeah, you're welcome.
Great. This has been such an informative and helpful discussion. Is there anything either of you would like to add before we wrap up?
No, I don't think so.
Well,
I would just say,
yeah.
Oh, sorry. No, I would just say that we're a public resource. We're putting your taxes to work, so definitely use this as a resource. If you find yourself in any situation like this, it's probably very difficult and you're probably not in the right mindset to necessarily be trying to tackle all this, because plan language is supposed to be written in a way that's accessible to everyone, but in a lot of cases that's not necessarily the case. And so we're definitely here to help you out. So thank you very much for the invitation, by the way, to Partnership to End Addiction.
Thank you. And I think you make such a great point. It's such an important one, I think, to highlight, is that these insurance denials come during a period of crisis, right? Maureen described this in her own story. Like, you are desperately trying to get care for your loved one. And so it's not a time where you can really be reading through plan language and determining what your rights are and what the process is. And so I think knowing that there's a resource available that can kind of help take care of that part and help kind of guide you through that part is really important, because I think that's often why the way the parity framework is sort of set up, it really does rely on consumers to identify when there are issues and to come forward. And it's very difficult for them to do that in a moment when they're really trying to get life-saving care for their loved one. And so this is a really important resource that can happen come at a really important time.
Yeah, I guess I would say also that the agency mental health parity is a focus right now. And it has been during the past 2 years. I would say a real focus of the agency to I guess to assist the public, but also I would say that the agency also targets plans, and what I mean by that is that there are people at the agency who basically look for violations of MHPAEA on a plan-wide basis. So these are systematic issues that affect hundreds or thousands of people. But there are limited resources. There would be no way for the agency to necessarily know that something is going on with one of hundreds of thousands or millions of plans. So yes, if you are experiencing an issue with regard to mental health, substance use disorder coverage, definitely call us.
Thank you so much, Maureen and Andres. Thank you so much for your time and for sharing your stories and your resources with us. And thank you. We will be sharing a number of links from the partnership and Department of Labor, some that Andres mentioned during his remarks. And we sincerely apologize for the issues we had with going live today, but are glad that we were still able to have this discussion and look forward to getting it out to our audience. So thank you, everyone, and I hope you have a great afternoon.
Yeah, thank you so much.
Thanks, Maureen. Thanks, Andres.